Hey everyone, Dr. JJ Gregor here today. Today we're going to talk about something that's kind of near and dear to my heart, really, and it's called stress. What is stress in reality? I say this to every patient. It's like, are you experiencing any stress? And most of the time the answer is, nah, doc, I'm good. Life is good, the kids are good, the house is good, the job is good. I don't really experience stress on a daily basis. And everything I find in the exam is telling me the opposite, that they're stressed out, that they've got other stuff going on. Where people kind of get confused, where stress kind of gets this one little lump diagnosis, is it's really, we think of it as just the emotional side of things. And in reality, we are structural, chemical, and emotional beings. We can have all three of those different types of stresses. So in the structural stress, that's, chiropractic 101. If your neck's out, if you have a subluxation, then that can be a stress. And then other things of trauma stress, like, hey, you broke your foot and now you're on crutches and your back hurts because you've got to walk on the crutches, or you're not walking right, throwing your low back out. That can be a form of structural stress, both the back and the foot, or those types of things. Then we also, the one that I see predominantly is the big stress in most people's lives, is the chemical side of things. And the chemical side is a lot, it's multifactorial, to use a big fancy word, but it's a lot of things. It's blood sugar, it's dehydration, it's environmental toxins, it's household toxins. Household toxins being something like a cleaner that just stinks, like Clorox or something like that. That can be a form of stress to your body. Blood sugar is usually the one that I harp the most on, that most people in today's society really screw up. Most of us, myself not included in this, eat way too much sugar. I eat too much sugar for me, but compared to the rest of the population, I eat no sugar. The average American today eats somewhere between 120 and 170 pounds of sugar a year. That is a ridiculous amount. And that causes a myriad of stress problems that present. So we're not going to get into that. Those are for other videos. We've talked about them in the past. Go look those up on YouTube and do that. Then also, dehydration is another form of stress. That is a lot of patients. Those two things, the dehydration and then the blood sugar, those are the two biggest things that I have to make sure is fixed in all of my patients to make sure that they get well. So stress isn't just what you think. It's really multifactorial. It really is a chemical, a structural, and the emotional, which everybody kind of thinks it is. So what are some ways to diminish your stress? Make sure you get enough sleep, make sure you balance your blood sugar, and make sure you you drink enough water. So doing those three things, eating a good protein and fat-based breakfast with a little bit of vegetable, getting enough sleep at night, 7 to 9 hours in a dark room, no electronics, no TV, no phone, no iPad, those types of things. And make sure you get enough water, at least half your body weight in ounces, if not 2/3 your body weight in ounces, in a good spring water or a good mineral water of some sort. The best I like personally is Mountain Valley Spring out of Arkansas. It's great water. No financial ties to them. I just think they're a great product. So that's the three things you can do if you feel any kind of stress, but those are the three things to look at if your doctor's telling you you might be a little bit stressed. Until next time, make your health easy and have a great day.